I got great patients in my practice, and as great as they are, they don't always get better like you'd hope they would. I often see patients as well who've gone to a quick medicine place, a Ready Med or an urgent care center because they're not getting better. Well, I have a couple of patients in my practice over the last year who had a cough that wouldn't get better. And in my practice, because we do a lot of natural stuff, they had tried olive leaf extract. They had tried some of the natural remedies, vitamin C, immune stimulators, those kinds of things that typically would help someone get better if it was a simple virus. Viruses generally clear on their own. And viruses generally don't give you the same kind of symptoms. You don't cough up lots of lung material and green stuff and gross things like that. And they generally get better. The same with a bacterial infection. Typically they'll be treated with antibiotics in a conventional setting and they'll get better. Well, there's a new game in town. It's called valley fever, and it's a type of fungus. The disease is called coccidioidomycosis, which all by itself is enough to make you a little scared. But it's nothing to be scared of because it's very treatable. But you have to know that everything that happens with an infection, either it's a sinus infection or a cough or some kind of low-grade upper respiratory thing, it isn't always either a virus or bacteria. Actually, and this is very exciting that the regular medical world is getting a hold of it, it could be fungus. And the great thing about it is it's easily treatable with an antifungal medication. So, of all the people in California and Arizona, 10% or more are having this type of infection. It's a fungal chest infection, not life-threatening usually. Less than 1% of the time they go on to be big trouble. But boy, talk about annoying coughing for 3 or 4 or 5 or 6 months. And on top of that, you get antibacterial treatment with an antibiotic that just makes it worse. So what I do is I'll see the patient, figure out their history, and consider that. You can do a blood test to check it to be sure, or you can put them on an antifungal medicine called diflucan or something like it, and always give them a breathing medicine that makes their bronchial tubes open up so that they can breathe easier. And occasionally we'll give them a little cough medicine, but usually we don't need it. So valley fever is a kind of chest infection that you should be aware of that causes a chronic cough that just doesn't get better with regular treatment. Talk to your doctor about it and have him consider giving you an antifungal if that makes sense to him. And remember, with whatever that you do, you're not getting better the way you'd expect. Always check with your doctor because we're better together.